Specifically, this was Richmond and Chesterfield starting to come together to address what has been a disproportionate impact of COVID-19 on the Hispanic and Latinx communities. They say that in Richmond, 32% of the cases and about 30% of the hospitalizations of COVID-19 are members of the Hispanic community, but they only account for about 6% of the city's population. And in Chesterfield, they're seeing about 15% of the cases, but only have about 9% of the population. And Dr. Danny Avula, the Richmond Health Director, said that they started to work together after looking at the heat maps or the hotspots of these COVID-19 outbreaks, and we're seeing them appear in the city's south side along and into Chesterfield County. And they say their investigation so far has found some of the reasons behind these potential disproportionate impacts on the Hispanic community are outbreaks in job sites where there are a large number of Hispanic employees. They say there are a lot of home situations where there are many people living in small quarters, and that makes social distancing and isolating from family members more difficult. And additionally, say they are still combating something they already knew about, is distrust from those in that community with government officials and having them agree to accept their help. They say they have several ways they are trying to address this right now, but they have also now are getting help from the CDC, who've brought in a team this week to help out with this response.
They have a broad national view of how this pandemic is impacting Hispanic communities and have access to a number of resources that could come alongside us. And so the CDC has now deployed a team of 6 individuals who have come here to Richmond. They started here this week and have been working closely with Richmond and Chesterfield to help define our response.
And Dr. Avula says the CDC team will be here for at least another week, and then we'll reassess at the end if they need to stay longer. And he touched on one of the things the city is doing to try and help with one of those factors leading to these outbreaks is the program to put people up in hotels during their time of isolation. But he says so far it has been difficult to get people to take them up on that offer, saying only 4 people have agreed to do so at the moment.